Hey guys, welcome back. This is Dr. Dwain Woode from Diabetes and Endocrine Wellness Center and the Light Away here in Huntsville, Alabama. One of the things that is really on everybody's mind right now is COVID-19. And with COVID-19, everything has changed. The way we work, the way we play, the way we get our medical attention and our care. I am so excited because we've got a special guest that's going to be joining us today, Dr. David Peterson. He is a physical therapist here in town. He's been practicing for 20 years or more. We've got some special questions for him about physical therapy, and we'll even have him share his thoughts about whether physical therapy is a place that needs more people to come into it, right? So without any further ado, let's go ahead and get Dr. Peterson on the stage. All right, David, thank you for joining us today. We really appreciate you taking some time out of your schedule. Welcome.
Thank you for having me.
Awesome, awesome. So tell me, how have you been dealing with, aside from your practice right now, how's your family? How are you guys dealing with the COVID-19?
Family's awesome, man. It's the hardest thing is just really the kids want to go outside and play, but they really can't go out and play with everybody. So it's just one of those, how do we get the exercise in? How do we get the socialization in a world of social distancing?
Right, it is surely a new world that we're living in, isn't it?
Yes, sir. Yes, sir.
Uh, well, tell me a little bit about yourself. I did a little intro there. Tell us who David Peterson is. Tell us a little bit about what you do, and really what got you to where you are right now.
Wow. Physical therapy. I love seeing things move. I love seeing things get better. I was an athlete a long time ago when I had black hair. Track and field, martial arts, wrestling, football, and so I saw a lot of injuries during, my participation. And one day I said, I just want to help people. I want to be that person and figure out how to people get back on track, get back to where they are. And so physical therapy jumped up and gave me an opportunity to do just that, finding people who have goals that want to move farther in life to do those things physically. So that's what we do.
Wow, amazing, amazing. So tell me, someone has an injury.
Mhm.
How do they get to you?
Typically through a doctor's referral. Usually see the doctor first, and the doctor says, hey, you might need some exercise, you might need some therapy, and then they get a referral and they come here. But they can also come straight here, and we can call the doctor and get a referral that way too.
Okay, all right. So they can actually pick up the phone and call and tell us the name
Yeah.
of your practice.
It's Dynamic Performance Physical Therapy and Rehabilitation Incorporated.
All right.
Yeah.
And how did you come about that name? Dynamic Performance. That
Dynamic Performance. I was thinking about my name, David Peterson, and the D and the P worked real well together. And the doctorate in physical therapy is a new degree when I got it. So it was the D, the P, and the T. And we're trying to figure out something that replicated that pretty well.
wow,
And
I
it
love
did. It worked pretty well.
that. I love that. Very creative.
Yeah.
Um,
Yeah.
all right, so someone has an injury, they think they need physical therapy, or their doctor thinks they need physical therapy. They send them to you. What are some typical things that you see in terms of injuries or even conditions that patients have that they come to you for?
Most of the patients come to me because of joint pain or balance problems. So joint pain might be headaches, it might be back pain, knee pain, elbows, hips, balance problems. You have patients with Parkinson's, you have patients that had strokes, patients that had, accidents where, it just leaves them off kilter. And so a lot of times we see those types of patients and we take care of the joints.
Okay, all right, fair enough. And so someone comes in, their doctor sends them. What can they expect when they first come in to see you? What kind of assessments do you do? Um, tell us a little bit about that process.
The first thing we do is find out what the patient wants out of therapy. Typically, if they're coming in, it's not voluntary. Usually, you come because something's hurting really bad or you're falling a lot. And so they come in saying, I want to get rid of this back pain, or I want to, stop falling. I want to get rid of this walker or cane that I'm using, or these crutches. And we look at the joints, we look at the muscles, we look at the nerves, see how they're moving, check out their coordination, their balance, their strength, their flexibility. And then we ask them real questions about what their goals are and what's measurable. And once we get the measurable goals in place, we talk to them about how we're going to get it done. And usually it includes a lot of stretching, a lot of exercise, manipulation, massage, whatever it needs to do to get the range of motion first. And then we work on strengthening next. And after that, we look at the balance. That's usually
Okay.
how it works out.
All right, good, good. Now, we take care of a lot of patients who have diabetes, they've got neuropathy, of course, they have balance problems. Are there any things that are peculiar or special about diabetics as you deal with them? How do you do an evaluation for those folks?
The evaluation, it includes the things we usually do for most patients, but it also includes things like what's your blood sugar level? What are you doing as far as your neuropathy is concerned? We actually ask a lot of specific things about, we look at their feet. I want to make sure that they're being taken care of like they're supposed to be. We talk about, because we look at the blood sugar levels, we ask them about that because exercise can actually have you um, lethargic afterwards. Blood sugar levels can drop quickly. So we want to make sure we know what this patient goes through on a regular basis so we know how to make sure it's a safe environment for them when they're here.
Oh, awesome,
And then
awesome. Okay. Now, one of the things that we sometimes will hear from a patient is, oh, I don't think physical therapy is for me. All they're going to be doing is, having me balance and stretch. I could do that at home. What would you say to someone to say, hey, no, physical therapy really can assist you in whatever you're dealing with?
you know what happens? In everyone's life, there are things we can do at home, but it's not necessarily that we're going to do those things at home. We can eat right at home, but most people don't. We can exercise at home. Most people don't. So therapy, my job is to make sure you do it while you're here, so it's done correctly, so that after you've exercised, you're not hurting. And if you are hurting, I can fix it. So it's something you can continue with. Most people stop the exercise program on their own after the second day. They go the first day at the gym, they do all these wonderful things, and they go back and recognize that that actually hurt. That was actually painful. And they lose that motivation to do it again. Because the idea is the more you do it, the better it is. But with physical therapy, not only are we going to exercise and do all the balance and stretching, but we also have a lot of toys here like heat, massage, manipulation, ice, a lot of laser treatments to get rid of the pain before you actually leave the office. So you worked it up, you wore yourself out, I fixed it, now you can leave happy. So you're not stuck with that lingering, what's going on with my back, or those questions to get rid of the pain. So yeah, therapy will get you taken care of. And usually we go 2 to 3 days a week. So you get that program that you need to get that you would be doing on your own, but really not. And you have somebody here to answer all your questions and take care of your concerns while you're here. So it works out pretty well.
Well, that's amazing. Several years ago, I had some pain issues, and my doctor, my neurologist, sent me to physical therapy, and it was amazing that even some of the simple things that they had me doing in terms of strengthening my core, strengthening my
Mm-hmm.
back muscles, things that I hadn't even thought about because I thought it was just pain. So let's deal with the pain. And she was like, "No, we got to get those muscles strong." So tell us a little bit about that process.
Oftentimes you're looking at patients are looking at a pain problem, but the therapist is looking at the cause of the pain in the first place. So, you might be having back pain, but the problem is actually your pelvis is out of line, your lower extremities are weak, the way you're sitting at work or the way you're sleeping at home, your postures are off. Those are the things that are causing the problem, but people just want the pain gone. And so if you want the pain gone long term, the physical therapist's job is to make sure that they go through every area of your life that could be causing you this pain and help you tweak those things to the point where the pain goes away long term. Everybody wants it gone overnight. but a lot of things it's your fault as to why it's there. And my job is to teach you how to take care of you the way you handle you every day.
Right,
Um,
right.
I have, I have had NFL football players on my table, and I've also had couch potato people on my tables. So for the couch potato person, they have the same need that a football player would have, but they're using it differently. So my job is to make sure I find out what your lifestyle is like and how we can enter into it to get you to a point where you can stay where you need to be and stay healthy too.
Okay. Now shifting gears just a little bit. So you have a doctorate in physical therapy,
Yes.
and so you said that that was a new degree when you were first coming out. I'm
Mm-hmm.
sure there are a lot of people who may have heard about physical therapy. They've not been to physical therapy, so we're sharing with them right now kind of what some physical therapists do. But if you have a young person coming up and they're trying to pick a career and they want to shadow someone, what would you say to encourage them to maybe even think about or try physical therapy as a career?
The big Okay, so to be a physical therapist, you need certain things to be going well for you already. You have to like people because just like any helping professional, people are there. You got to like helping people. And then you have to like science. So as you look at your transcripts and things like that, if you're passing everything else and you're not doing so well in science, it might not be the right thing for you. But physical therapy is heavy in science, it's heavy in psychology, and it's heavy in just kinesthetic, moving around, touching things. We're kinesthetic learners, most of us. And another thing about physical therapists, we work closely with the patient. So manipulations, massages, stretching, exercising, those are very close proximity type activities. So if you like doing those things, it might be good for you. If you like school, it might be a good thing for you. Um, if you like being active, a lot of physical therapists are/were athletes. So it's a really big thing. And a lot of people appreciate it because we're living longer these days. So now you could be 80 years old at the nursing home, or you could be 80 years old on the golf course. It's really up to you on how you take care of your body and your team of people around you. So if you like seeing people active, like helping them stay active, physical therapy might be a good place to be.
Now, when we started, you mentioned that you did karate, you did sports, just a list of things. You also mentioned that you take care of football players. Now, someone who's going into physical therapy, do they have to be like, the jock on the team? Do they have to be an awesome basketball player? Is that a requirement?
No, not at all. I think the biggest requirement is being observant, being willing to help people. And that's where you find people. Usually, when people come to physical therapy, it might be the jock on the team, but now he has a torn ACL and he's expecting you to motivate him and know what you're doing to get him back on the team. So, as long as you observe it and you're willing to help, that's a good start. It's a very good start.
Okay. And so the elephant in the room for every profession right now is COVID-19. In our practice,
Oh,
it really has changed, how we practice, changed how we
mhm.
see patients, how we take care of them. How has it impacted what you do and things that you do in the office?
Well, just like everybody else, you have the temperature scan at the front desk. You are wearing masks. We're asking you questions about where your whereabouts have been. Um, we're wiping down the machines between each use of patient. We're being a lot more careful, make sure people stay 6 feet apart. So it's different in that you got to be a lot more cautious on the little things, the very detailed things. With COVID is, we're watching you breathe. You start coughing too much, we're gonna start sending up red flags. Um, yeah, it's a hard time for everybody. As far as patient load is down, but people who need it will be here, and that's what's happening. We're seeing a
All
lot more
right.
home visits now. A lot of people are scared to get out. So that's how we're looking at it.
Well, good. So I'm glad you mentioned that because, with COVID, people are apprehensive to get out and maybe come to therapy, um, or even people who didn't need therapy before, they're now sitting at home, they're on the couch, they're watching TV, they're putting on weight. First,
Mhm.
what are some recommendations that you would have for them with respect to dealing with COVID and that, and their activity? And then, are there things that they could do at home that will help with that process?
Definitely. People have to recognize that we are in a pandemic. So I do recognize that things have changed. A lot of times people would be going to the gym. Gym's not as safe as it used to be. People might have been going to different social events where everybody would exercise. We're really not doing that as much. So now we're looking at things that are virtual. You have virtual personal trainers. You have virtual physical therapy. You have virtual exercise programs that you can pull up, doing things around the house that are active, maybe a garden, walking around the house, doing exercises in the house, because it's not safe as much as it used to be, and finding places that are being COVID friendly. Making sure you go to the places that actually people are required to wear masks, where their temperatures are being checked, those type of things, and staying away from places that are too free, like restaurants and things of that nature.
Well, awesome, awesome. Well, I really appreciate all this information. Wonderful. Anything else that you want to say to our viewers right now before we sign off?
The biggest deal is you are the best person to take care of yourself. If you know you have a problem, go to your doctor, ask for help. The doctor is always the best people to know what's going on. If you think therapy is a good idea as far as your balance, your strengthening, your pain stuff, let them know. Let me know. We're here to help. This is what we do for a living. Thank you.
And once again, how can people get to you? The practice name is Dynamic Performance. And
Dynamic Physical Therapy, 256-837-5425, 256-837-5425. And if people have questions about their insurances, things like that, we also have free consultations. So that's always a good way to get started, to talk about, hey, let's look at if this is something we can work out. So I'm here for that too.
okay, awesome. Well, thank you, Dr. David Peterson. We really appreciate you spending some time with us and educating us about physical therapy and giving us some advice on what we can do here during this COVID era. Can you give us a tour of your office? I know I'm putting you on the spot there, but maybe you can turn your camera around and show us what you got there.
Welcome to my office. Um, if you were coming into my office, we will be looking at first the evaluation rooms. So you look a little like this. So you have a table, curtain, and then we have different exercise equipment. So we'll have our pull-up bars, we'll have our ellipticals, we'll have seated ellipticals, arm bikes. We even have golf for our balance activities. We got treadmills, we got stairs. Pretty much therapy is all about playing pretend. So anything that you like to do, we have the toys here to figure out how to get you back to doing those things. Um, we have people that run here. We have hurdles. We have basketballs. We have footballs. Trust me, if you can dream it, we can figure it out as well. But our job is really to get you to the point where you figure out the things that you used to be able to do, that you want to be able to do, and we use the small muscles to build you back up to getting it there. So we even have the weights, and we have you see the 2x4. That's for our balance stuff. Um, Man, we have a lot of toys. We have a lot of toys. Speed ladder for our basketball players, football players, and then for our people that had strokes and Parkinson's. So everybody's invited. Everybody's invited.
So we really appreciate Dr. Peterson spending some time with us and telling us a little bit about physical therapy. Once again, if you've not done so, guys, let's go ahead and hit the subscribe button, hit the bell so that you'll get alerted when there are new videos that come out. If you've had physical therapy, if you've been to see a physical therapist, if you think you need a physical therapist, go ahead and drop us a note in the comments. Let us know what your experiences have been and any questions that you may have. We're going to do a follow-up with Dr. Peterson where we can actually go into his office and maybe look around and have him actually show us some exercises that he may do. All right. Thank you once again. This is Dr. Dwain Woode from Diabetes and Endocrine Wellness Center and the Light Away, educating the public for a better you.